Back, the doctor is in here on Des Moines Local Live, the world's first local and live radio station focused on Iowa. Heard daily on MaxWorldLive.com. I'm Ray Thompson, here with Dr. Alan Koslow, who is about to rant.
Yes, I have not been as upset at a Democratic politician as I've been this past weekend when I heard what Senator Harkin introduced as a bill in the Senate this past week. Basically, his bill is saying that Medicare, Medicaid, and all insurance companies have to pay complementary and alternative medicine practitioners, regardless of whether they have a license, regardless of whether they have certification from a state. All they basically have to say is, I am a practitioner. And that the insurance companies have to pay them at the same rate that they pay physicians for the same visit. So in other words, we have that if someone comes in for a certain...
Oh, I like that bill.
Now, listen to this ridiculous backward logic that that Senator Harkin has about this bill. The first thing is he says that this is going to reduce the cost of medical care. And his rationale for it is because people will be going for these types of treatments rather than going to doctors, and these treatments are cheaper than going to doctors. But if he pays the exact same amount as for this treatment as he's paying to doctors, to these complementary and alternative medicine doctors, it's not going to reduce a single bill at all unless the patients, rather than going for the chemotherapy or rather than going for the surgery, which they need in order to stay alive, go to these complementary and alternative medicine doctors and get some woo-woo practice on them and end up dying.
Woo-woo is one of my favorite terms for this.
Well, it's I know a lot of people who like woo-woo.
Hey, I could drive a Mercedes like doctors do.
Yeah, you could. So
I mean, yeah.
It's absolutely ridiculous. Basically, anyone can hang out a shingle and say, I am a practitioner of complementary and alternative medicine.
Well, they can do that already in this state. They just can't get the insurance companies to pay them anything.
Right, but with his bill, the insurance companies will be legally forced to pay. You know, the insurance companies aren't even legally forced to pay doctors for their care if the insurance company thinks that it's not appropriate to get that treatment. And this will say you have to pay the alternative medicine doctors regardless of whether it works, regardless of whether the doctor has any, doctor, I call him doctor, regardless of whether this practitioner has any training at all, regardless of whether there's any evidence that, that this is. And so what they're doing is they're making it more and more strict that that doctors practice evidence-based medicine, which means that you have to show a research study that something works before the insurance companies or the government will pay you for it. Here they're saying that no, in this one group of practitioners, you don't have to show any evidence that it works. You don't have to show any evidence that it helps people. You don't have to show any. Anything you give them
doesn't have to have FDA approval or trial studies or.
Right. You don't have to show any evidence that it's not harmful, and you don't care the fact that the patient is foregoing legitimate medical care in order to get this. It is just absolutely bizarre that that this is that he would think that this bill would in any way, shape, or form help anybody. What it's going to do is it's going to create a group of charlatans. It's going to make it legal to scam people. It's going to make it legal for people to get treatments from people who know that they don't work. And
did you hear that noise?
What noise is that?
That was money being sucked down another black hole that politicians have created.
Well, he hasn't created it yet, and if I can do anything, I am going to ensure that this does not get created. This is just absolutely bizarre and ridiculous, and I can't tell you how much.
It's not responsible.
It's not responsible. It's Deshay was problematic. The Institute for Complementary and Alternative Medicine had the potential for having some benefit.
Sure did.
This is all that this is going to do. This is actually going against the concept of the Institute for Complementary and Alternative Medicine. Why set up an institute that's burning hundreds of millions of dollars to do research if you're going to say it doesn't matter whether they have research or not for it to work? You're basically saying without the research, we're going to go ahead and pay them for this. This is just absolutely bizarre, ridiculous, and I am just so disappointed in Senator Harkin, that he is doing this. I hope someone sends, I'm going to send this to him, and I'm going to hope that he listens to it, or that his people listen to it, because this is really ridiculous. I'm actually going to be meeting with him in September in his office in Washington, D.C., and I can tell you I'm going to give him and his staff a piece of my mind about this. I'm going to repeat this rant there in front of him, and I've had a very good relationship with him for the last 15 years, and this just really just exasperates me. And it's not because I'm absolutely against complementary alternative medicine. I am for show me the money, show me the evidence. Just like medicine is required to do evidence-based medicine, all I'm asking is that complementary and alternative medicine is given the same standard. Show me that it's effective, show me that it's safe, show me that it's better or at least equivalent to other therapies that are out there. And I will be the first one to back that it should be used. As Linda said, biofeedback. Biofeedback was a complementary and alternative medicine technique. It is now a mainstay of medicine.
Hypnosis is another one.
Hypnosis is another one.
Properly used.
Properly used. And this is what happens. If something is shown to work, medicine will take it up. It's sometimes even something that you think is a problem, or something that is in medicine. It took 20 years for mainstream medicine to accept that gastric ulcers, peptic ulcers, were caused by bacteria.
Right.
And so even within medicine, we do, it takes time. But once it is proven and shown that it works, medicine brings it in as its own.
That's just the scientific method, period.
Right.
Whether it's medicine or any other area of science.
Right. And so I'm going to say goodbye to you and hope to see you next week. And I'm going to go and try to do my exercise so that I can cool down from being this upset. So thank you very much for listening. Ray, take it away.
All right, ladies and gentlemen.